Hundreds of thousands of people in North Carolina will face higher health insurance premiums. The State Health Plan Board is set to vote on the higher rates tomorrow. The board says this increase is necessary to cover the expense of the program. WRAL Capitol Bureau Chief Laura Leslie is live at the Legislative Building. Laura, how much more will employees have to pay?
You know, Gerald, for the first time in state health plan history, premiums are going to be on a sliding scale, right? So if you make $50,000 a year or less as a state employee, you're going to see a smaller increase. But if you make $90,000 or more per year, you'll see a larger increase. And the increases don't depend solely on your pay. It also depends what plan you're on. For a single worker making under $50,000 a year on the basic plan, the premium will go up to $10 a month. But a single worker making that $90,000 a year on the plus plan will see an increase of $110 a month. Other changes don't depend on your salary at all. Copays are going up for just about everyone for most prescription drugs. Emergency room copays will nearly double, and the annual deductible for the standard plan will double. The State Health Plan Board will vote on these changes tomorrow. Plan Director Tom Friedman expects it will pass. Why were these increases necessary?
At its simplest level, the past 8 years, the state health plan has been spending more money than it was taking in. The previous treasurer came in with significant reserves. Those reserves are gone. So as healthcare costs continue to increase without reserves, we had to make pretty significant changes.
The plan was projected to run out of money next year unless changes were made. Other changes will include lowering costs to enroll children in the health plan, and they're also getting rid of the tobacco attestation and the higher premiums for smokers. Groups that represent teachers and state employees say they are disappointed by the increases. We'll hear, especially in a year where they haven't gotten any raises. We'll hear from them coming up at 6. Laura Leslie, WRAL News, live in Raleigh.